Today we're going to start talking about the anatomy of the nasal cavity. The cellar region was a topic we already spoke, okay? So, as René Descartes say, we need to go from the simple to the complex. For the simple to the complex. So, first we're going to start talking about the bones, all of them separate, later all together. Later we're going to talk about the irrigation and the venous drainage of the nasal cavity, then the innervation, okay? And in the end, the cellar region, but once again, we already spoke about the cellar region when we spoke about the dural folds. So that's the way the neurosurgery resident try to understand the endoscopic approach, because it's hard first to understand the anatomy, because we have a very narrow corridor there, and we need to try to understand the anatomy very, very well, because we don't have too much space. So the nasal cavity, as we can see here, it's going to have walls. The nasal cavity is going to have different walls. One superior wall, medial wall, lateral wall, and inferior wall, okay? All of these walls are conformed. This is like a Transformers. For the people who see the Transformer movies, we're gonna see all these bones structures. They are like the composition of different parts of different bones, okay? We're gonna have also here anteriorly, we're gonna have like an anterior door, let's call it like anterior door, and we're gonna have also a posterior door here, okay? This is gonna be the enter point or exit point, the communication between the nasal cavity with the exterior, okay? And another one, to bring or putting out the air from the nasal cavity to the rest of the body, to the rest of the pharynx, larynx, okay, or in the positive wave, okay. So the anterior, we're gonna have anteriorly the piriform aperture. You see, it's piriform because it's gonna have the shape of a heart. This is a heart, but you see, it's like upside down heart. It's an upside down heart. Is the cranium? Yes, exactly. Is Da Vinci drawn? Yes. So you see, this is the cranium and this is the piriform aperture. Okay. Also, it can be called anterior nasal aperture. And posteriorly, we have the choana. So now we understand nasal cavity, anterior aperture or piriform aperture, posteriorly choana, superior wall, inferior wall, lateral wall, medial wall. Good. This cut we are seeing here, this is a medial sagittal and this is a sagittal, okay? Sagittal and medial sagittal. Why do we know this is a medial sagittal? Yes, we're gonna talk about more later when we see here this cut cross exactly in the middle line of the body. So here you can see an endoscopic view of the piriform aperture here, okay? And here also you can see the nostril. You can see when we have the skin, there are two nostrils, okay? The two nostrils. And the bony part, remember, is the piriform aperture. Good? Okay. So now we need to talk about all the bones, all of them separately. First, we're going to start talking about the maxillar bone. So as you can see here, again, we can see the piriform aperture. Yes, we just need to use the imagination, because here we have the nasal bones. Okay, so as you can see, both of the maxillary bone, they're gonna make the lateral wall here. You see, this is the ascending process or frontal process of the maxillary bone. This is gonna be the anterior part, the most anterior part of the lateral wall. And also, if you can see this here, down here, you're gonna have down here the inferior wall, but not all the inferior wall. This is the palatine process of the maxillary bone. It's gonna be the 2/3 anterior of the inferior wall of the nasal cavity. So we can say now we have the maxillary bone. The maxillary bone, it's part of the lateral wall and the inferior wall. Okay. Now you can see here, this is the inferior nasal concha or turbinate. We have three. Usually we have 3 turbinate, but also we can have 4 or 5. But this is, they are supernumerary turbinate. Okay. So normally we have the superior, medial, and inferior turbinate. The inferior turbinate, as you can see here, is an isolate bone. Okay. The inferior turbinate, it's an isolate bone. If we see here in coronal view, we're gonna have here the nasal septum in the middle. Remember, inferior wall, we say this is the palatine process of the maxillary bone. And here we have the ascending process or frontal process of the maxillary. So this is lateral, this is medial wall, this is inferior, and then the turbinate go here. The inferior turbinate go here. It's an isolate bone. Go here. This is a turbinate. And now you can see the turbinate gonna become a part of the lateral wall of the nasal cavity. But as you can see, between the lateral wall and the medial wall of the turbinate, we're gonna have here a space. Let me put another color. Yes, you have this space. This space is called meatus. We have 3 meatus. Meatus inferior, meatus superior, and meatus medial. Okay? They are between the medial wall of the turbinate and lateral wall of the ascending process. Okay, between both of them we have the meatus. Okay, so continue with the lateral wall. As you can see here, you see this little guy here. We have the lacrimal bone. Okay, the lacrimal bone is gonna be part of the lacrimal duct. Okay, for that reason, it's gonna be part of the lateral wall. Important. You see, we're gonna find this part of the lacrimal bone posterior to the frontal apophysis of the ascending process of the maxilla. Okay, and you see here also the sphenoid. You see here the sphenoid, the pterygoid process of the sphenoid. The pterygoid process of the sphenoid gonna be the only part of this bone gonna be part of the lateral wall. And continually here, okay, we have maxillar, lacrimal, ethmoid. Now the ethmoid. You see here the ethmoid bone have 2 parts, let's say like 2 big surface. One endocranial and the other one is extracranial. The endocranial part is the anterior floor of the skull base. Okay, you see we have the crista galli here, we have the lamina cribosa here. This is the superior view. But now if we see the extracranial part, now we have here this is the labyrinth ethmoidalis, and this important part here is the perpendicular plate. We're gonna talk about that because it's gonna be very important part of the middle wall. So we have, you remember we spoke about the turbinate or concha. We have the ethmoidal turbinate, superior and medial, and this is the here the space. We see the space between both of them. Okay, this is the meatus, superior and medial meatus. And this one here, this is not a turbinate. Okay, this is the unciform process of the ethmoid bone. So now we have all the structure here in this anterior part of the lateral wall, and in the end, remember we have here the palatine bone. The palatine bone, we're gonna have two parts, one ascending or vertical plate here, and one horizontal plate of the palatine bone. We're gonna have two surfaces in both of these plates. In the perpendicular or vertical, we have one inner looking inside to the nasal cavity. It's called nasal surface of the vertical plate, and the lateral here, lateral surface, is also called maxillar. In the horizontal plate, the superior wall, superior surface, is called nasal surface because it's looking to the nasal cavity, and the inferior wall, inferior surface, is called palatine surface because it's in relationship with the hard palatine process. Okay, so now we have all the elements of the lateral wall. Okay, and we finish with the lateral wall. So important. Now you see the ethmoid bone is very important in this nasal cavity because it's medial wall, lateral wall, superior wall. Because now we see here the superior wall. You see, this is superior wall. The superior wall is conformed again, another transforming by the nasal bones. You see here the nasal bones, and also we talk about the lamina cribosa. And you see this part here. This part here is the frontal bone. This is the spine of the frontal bone. And in the end, I'm gonna have the body of the sphenoid. Let me show you the sphenoid here. You see, we're watching the superior wall, lamina cribosa. Here you see the sphenoid. This is the anterior view of the sphenoid body here. So, superior wall, nasal bones, spine of the frontal bone here, cribiform plate or lamina cribosa, and so now we have here the middle wall. The middle wall or septum, we're gonna call it a nasal septum. We're gonna have different structures. We're gonna have here, remember we talk about the perpendicular plate of the ethmoid bone. We're gonna have this border here, border and antero superior, antero inferior, posterior inferior, and posterior superior border. The elements, as we say, perpendicular plate is the most important, more middle wall here, and it's going to articulate anterior superior with which element? Here, with the posterior crest, here in the spine of the apophysis or process spinosus of the frontal bone here. In this anterior inferior, we have, remember, we have here This is bony structure, but we have here all the cartilage of the, we put in blue or in white, like cartilage here. Okay, nasal cartilage. Posterior inferior, we have the VOMER. You see the VOMER. Let me show you the VOMER. We have the VOMER down here, and posteriorly here with the sphenoid body. Okay. Yes, so you see septal cartilage. You see perpendicular period of the ethmoid here, septal cartilage, and the VOMER down here. See the VOMER. This is the ala of the VOMER, gonna be in the inferior wall of the inferior surface of the body of the sphenoid bone here. So with this already we know all the structures of the walls, or the structures that are part of the walls of the nasal cavity. Okay. And now you can see here in the sagittal cut, an anatomical way here, a good model. So remember, you have here the narinas. Here we enter. We have the turbinate. Between turbinate and the wall, we have the meatus. Okay. Palatine process. Palatine here also palatine process of the palatine bone. So with the irrigation of the nasal cavity, we're gonna have here the sphenopalatine artery branching from the maxillar artery, branching of the maxillar artery. Also, we're gonna have the coronary artery there. Yes, coronary or labial artery. They both make a circle around the lips and go an ascending branch there. Also, we have here the ethmoidal artery, anterior and posterior. These arteries that branch from the ophthalmic artery. And you see here the greater palatine artery branch also the maxillar artery. These arteries, they're gonna make a plexus. You see here, this is the ascending tabic or ascending septine artery of the nasal cavity, branch from the labial artery or coronary artery. Look, and you see the plexus these arteries make, the Kieselbach plexus between the anterior ethmoidal artery, superior labial artery. So facial artery, ophthalmic artery there, and make anastomosis there in this area. Remember, this anastomosis they make in the septum. And here you see the posterior ethmoidal artery, again ophthalmic, and maxillar artery. They make an anastomosis. And it's called Woodruff plexus. The drainage, it's homologous, you have the same name as the artery. You can see here the sinus, the maxillary sinus, the ethmoid sinus also, and the frontal sinus. Another view, endoscopic view. You see the sphenoethmoidal recess. Now another coronal view. You can see the sinus sphenoidalis here, and you see the coana. You see the coana. Remember the posterior. Let's call it like a posterior door here, coana. Usually we have 1 centimeter superior to the coana, the ostrium sphenoidalis here, like an overture, like a little foramen, okay, to communicate with the sphenoid sinus. Usually, another view here of the inside of the sinus, of the sphenoid sinus. So now let's talk about the innervation. You see the innervation of the nasal cavity. Easy. We have the sensation of the smell here is the olfactory nerve. This is the first cranial nerve. These small branches, they microscopic fibers. They also go up, and then after cross the lamina cribosa, they make this olfactory bulb. So now in the end, we can say the nasal cavity we can divide in two segments, one respiratory segment and the other is the olfactory segment. The olfactory segment is the most superior, okay? Is the most superior because we have here these little branches, fibers who are gonna become or go through the lamina cribosa and make the olfactory nerve. So in this area we have this olfactory epithelium. It's very specialized epithelium tissue. Usually don't have more than 3 centimeters long and 3 centimeters wide. The structures involved are the olfactory sensory neurons, the supporting cells, basal cells, and the brush cells. These olfactory sensory neurons, they are bipolar neurons. Bipolar because of the two extremity, because have some psychiatric disorders. And then supporting cells, they're like analogous. They are similar to the glial cells. The basal cells, they are in the near to the basal lamina of the olfactory epithelium. And the brush cells, they are like microvilli veering column cells. Okay. And in the end, we have now the inferior part here, the more inferior part. Is this the respiratory segment? Have a lot of irrigation, a lot of blood supply in the turbinate, and it's gonna make the air circulation better and get warm. Also, I'm gonna have this cilium, these fibricias. So this hair, this nasal hair, move. Avoid the entry of dust and any pathogens to the nasal cavity. So with that, it's enough from talk about nasal cavity, and with that we finish. Okay.